안녕하세요. NI필치과 원장 임필입니다.
Greetings, I'm Dr. Impir of LIM-PIL Dental Clinic. I'm honored to be here as a Master Course Basic Director. Albeit in a short time, we're going to address online a part of the offline Master Course. Today, we're going to talk about implants. And this lecture is for those who first face implants. Let's look at the overview of implants. In the past, before implant became widespread, after extraction, bridge, or denture were used, this was the traditional prosthodontic phase done in dental clinics. If the patient had missing teeth, surrounding natural teeth would be prepped and bridge prosthesis would be provided.
이와 같은 브릿지 보철을 환자에게 해주었습니다.
These days, implant treatment has become very widespread. Therefore, even if dental clinics do not recommend implant treatment, first, the patient comes up first asking for implant treatment themselves. Many patients feel like they need implant treatment. Today, we're living in an era where people believe implant treatment is okay and widespread. In an area with missing teeth, drill is used to prep the alveolar bone and artificial tooth is placed, or the implant is placed. After implant is placed, we can proceed treatment to stage. We can submerge the implant and do secondary surgery. Or healing abutment can be connected. Suture can be done for one-stage surgery. And then we wait for osseointegration to occur sufficiently, and once this is complete, abutment for prosthetic phase is connected, and after that, crown is fabricated. The history of dental implants. We have continued to make advancements. Let's briefly look at the history. In the ancient era, it's different from what we now perceive as implants, but for people with missing teeth, artificial teeth were placed to replace the missing teeth. Such attempts have been made from very old. Through medieval and modern times, and to today, various methods have been used to overcome missing teeth. Many people have used different artificial materials and placed them within alveolar bone and proceeded with prosthetics. Various types of implants have existed up until now, and the endosseous implant, or where implant is placed within bone, existed. And there's transmandibular implant, and also subperiosteal implant. If you look at the form, there's screw type, cylinder type, and bladed type. Looking at the materials used, there can be metal and porcelain. In terms of metal material, it can be divided into titanium, zirconia, and gold. These days, more than porcelain, more people use zirconia. Let's look at the images. Subperiosteal implants were used as shown. This kind of implant existed, and this is transmandibular implant. And the implants penetrated across the mandible. And here's endosseous implant.
맨디블 쪽에
So in the mandibular arch,
매립하는 이런 형태의
implants were placed.
네, 그동안에 쭉 긴 시간을 거치면서 우리는 이 치과
With time in dental field, various types of implants were introduced.
쭉 존재를 해왔고 사실 우리가 현재 하고
The
있는
start of modern day implant was first introduced by Dr. Bronymark, an orthopedic surgeon.
이 바로 이 브레네막이 정형외과 의사인 이 브레네막이 고안해낸 이와 같은
This is a screw type implant, and this is the very beginning of the implant we use today.
지금 현재의 시점으로 보면
Currently, there are 3 different implant designs that are currently in clinical use.
크게 이와 같이 세 가지 타입 중에 하나가 되겠습니다.
On the far left is external type implant. This is a traditional external hex type implant that has existed since the Bronymark days. In the center and on the right, they are internal connection type implants. Among the 2 implants, one is for one-stage surgery. In other words, implant is not submerged and the implant top is exposed, non-submerged type implant. And the one on the right is where the implant is placed below bone level. This is submerged type implant. We refer to internal submerged type implant as bone level implant, and as for non-submerged internal implant as tissue level implant. You need to be aware of these basic terms. Let's look at external type implants. External connection type implants. On top of implant platform, there is a hex, and on top, the abutment goes on. The benefit of external type implant is that it's very compatible with various prosthesis options. Different crowns can be connected. Disadvantages include micro leakage, micro movement, and marginal bone loss. This is not to say that these problems only occur with external type implants. These problems do occur with internal implants as well. The advantages and disadvantages listed here when comparing internal and external type comparatively compared with internal type, external type showed such traits. So for Ostem, the external type connection implant is US implant. Next, I'm going to talk about internal connection implant. Among internal connection type, I'm going to talk about non-submerged implant. It has this kind of design. As mentioned earlier, it is tissue-level implant. In the case of Ostem, it's SS implant. SS system is implant dedicated for one-stage surgery. Advantages of this implant include there's less micro leakage, micro movement, and screw loosening. Comparatively, there's less occurrence. Disadvantages include limited prosthetic options. Because there is smooth surface and the height of smooth surface exists like this, when implant is placed, the rough surface with threads
본 하방에
is placed below bone level and smooth surface is on top of bone. It is tissue level. If the interarch distance is tight, then there can be limitations in providing different crowns. Also, in the case of anterior area where aesthetics is important, if you place one stage type of implant, there can be problems in the aesthetic zone. Aesthetics are very important. If the gingiva is thin or if the height of gingiva is thin, in that case, if you place this kind of implant, the metal can be shown through, or even with slightest gingival recession, then the results will become unaesthetic. We need to consider these factors and choose the appropriate implant. Internal submerged type implant or bone level implant is what we use most frequently. As shown, implant abutment is connected internally. It is used frequently in aesthetic zones. Another major trait is that it has platform switching design. In terms of the diameter of the abutment that goes on top, this is connected slightly internally. The implant abutment junction is over here and the abutment goes on top like this, and in this case there's less marginal bone loss, and this has been proven by many researchers. This is referred to as platform switching, and this is one of the advantages of this implant. The disadvantages include the fact that because implant is connected internally, then there can be abutment sinking phenomenon, and there can be fractures in implant wall. This is often referred to as tearing. If the implant wall is thin, tearing can occur. Among ostium implants, the bone level implant lineups include TS and KS implants. Osseointegration concept has been first introduced by Professor Bernie Mark, and since we have always focused on this concept, the osseointegration. If you look at the origin of osseointegration, through research, it has been proven that titanium, once it is in contact with bone, it adheres to it. Based on such phenomena, we are using titanium screw as artificial teeth. If you look at 6 factors that affect the osseointegration, first is biocompatibility. Because titanium screw goes in, biocompatibility is important. Second is implant design. Third, implant surface. Fourth, the bone condition at the surgical site. Fifth, the surgical procedure. And sixth, loading conditions. Depending on that, the results may vary. This is titanium rod. As mentioned, there are 3 types of implant. These are mainstream options, and we can choose the implant accordingly with the different clinical situations. Implant titanium is generally classified into grade 1, 2, 3, 4, and 5. Titanium is divided by level of oxygen saturation. Grade 1 to 4 is classified as commercially pure titanium, or CP titanium. Commercially pure titanium range from grade 1 to grade 4. And as for grade 5, it is titanium alloy. The stronger it is, the closer it gets to grade 5.
1에서부터 5 쪽으로 갈수록 강도는 강해지겠습니다. 강도는
Although
강해지겠지만
grade 5 may have excellent strength, compared with grade 1, grade 5 has low biocompatibility, and grade 1 has better bone to implant contact.
5보다 그레이드 1 쪽이 훨씬 더 생체 적합성이 뛰어나고 골 접촉률이 좋다는 것이죠. 네, 그래서 이렇게 생체 적합성과
Therefore, we need to consider biocompatibility and strength to determine amongst grade 1, 2, 3, 4, and 5, the manufacturers actually make that choice. Most of the implants range between grade 3 and 4.
그레이드 3, 4 정도의 임플란트를 취하고 있는 것으로 이렇게 알려져 있습니다.
Yes, some options are made of grade 5 titanium. Let's look at Ostem's implant systems. There's TS, SS, US, and MS. Different implant diameters exist. Let's look at implant material. From TS to MS, there's grade 4, 5, and 5. As mentioned earlier, grade 5 means that it has excellent strength. The strength goes up in grade 5 compared with grade 4. Let's look at implant body type. There's one body type implant made of one body. In other words, abutment and abutment is set as one. It's one lump. Two-body refers to when abutment and implant are separated. This is a two-piece implant. One-piece implants are normally used in narrow areas like lower anterior region. Apart from that, in general, two-piece implants are frequently used. If we look at the image, in narrow ridge like lower anterior area, one-piece implant can be used. Yes, you can use two-piece too. As for this is implant for overdenture, and the image on the right serves as temporary implant in a dentulous patient when doing implant surgery before delivering final prosthesis in order to allow patients to chew and dine. This serves as temporary implant. Two-piece implant. As mentioned earlier, there's TS implant, bone level implant, and SS implant or tissue level implant. And there's also bone level implant with external type connection. These three designs are mainstream. Let's look at the body type. It can be divided into tapered and straight type. On the far left, the body form is straight, and in the center and right, these two implants have tapered bodies. The level of taper can either be 1.5 degrees or 6 degrees. Straight implant. It has a straight body. It is easy to adjust implant depths. In other words, the top and lower portion of the implant, it doesn't have any taper. It is consistent. In the case of tapered implant, it can dig into the bone very well. If you think of the form of screw, when you attach a screw on the wall, if the taper is huge and if it has a sharp tip, then it can be fixed easily. But if it has straight form, its ability to get fixated will go down. Therefore, at times when we do drilling and place implant, we'd be able to avoid cases where depth adjustment is very difficult. In other words, the intended depth of the implant can be achieved. In the case of tapered implant, compared with a straight type, it's easier to drill and it's easier to do angle correction, and drilling steps are fewer. It can be inserted very easily and it is safe from anatomical limit. It is comparatively more safe. For instance, if there's natural tooth root or inferior alveolar nerve or sinus, compared with a straight body implant, if the implant is tapered, we will be able to avoid damage to anatomical structures in placing implants. As mentioned, in the case of tapered implants, it is very easy to insert, therefore it has good primary stability, and early loading or immediate loading can be done. It is more favorable compared with a straight body type. In Ostem lineup, it is US implant. It has external connection. The hex is at the top, and on top, abutment is connected. Let's look at US type connection method. If we expand the image, on top of platform, there's hexagonal shape on top, and the yellow is the abutment. Abutment is connected. Between implant and abutment, there's an abutment screw that binds it. In internal connection, there's TS and there's SS. TS type is bone level implant, and this one is tissue level implant. As mentioned, the implant and abutment is connected like this. As for SS implant, when placing implant for one-stage surgery, when connecting abutment, it will be like this. If you look at the connection area, you can see the difference, and it will help you understand. Up until now, we have looked at macro design, and now we will look at the implant surface. There has been continued advancements in terms of implant surface. In the early days, we used a machined surface or smooth surface. This was the first generation surface. With time, in order to promote osseointegration, rough surface was introduced. Currently, we use SLA implant, and SLA implant is also rough surface implant. And now we have taken a step further, called bioactive surface. On rough surface, additional chemical properties have been added to hasten osseointegration and to allow earlier loading. I believe better surfaces will be available in the future. Continued research is being conducted in all implant companies. First generation surface is machined surface. Let's look at the surface roughness. It is frequently referred to as RA. Let's look at the figure. It is between 0.5 to 0.8 micrometer.
러프 서피스가 아니었기
Because it
때문에
wasn't rough surface, the implant
임플란트의
success
골
rate
밀착, 다시 말하면
was
성공률이
less than
지금의 러프
80%.
서피스보다 낮았어요.
So it's
그래서 대략
lower than
80%
that of
정도
rough
우리가
surface.
성공률을 그렇게 봤고요. 그렇다 보니까
In order
아무래도
to
그
maximize bone to
면적을
implant
최대한
contact,
많이
the implant
확보했기
length
때문에
was
임플란트의
much
길이가
longer.
지금보다는 과거의
In the past,
임플란트들은
people
훨씬 더
used
길었습니다.
implants of 10 millimeters
이상
or
되는
over,
임플란트를
and
그때
if the length
사용하기로
was
했었고,
shorter
그것이
than
길이가
that,
작아지면
because the
아무래도
amount of
골과
bone to implant
접촉부
contact
면적이
area
작아지기
decreased,
때문에
the success
성공률이
rate
낮아질 수도
also
있는 그런
got
상황이죠.
reduced.
이게 좀 더 발전을 해서 이제 러프
Second
서피스
generation
시대가
surface is
되면은
rough
표면이 이제 점점
surface.
거칠어지게 되는데
TPS
TPS는
was
이제
introduced by Straumann.
스트라우만사에서 처음에 이제 개발을 해서 내놨던
It
건데
stands for
티타늄
titanium plasma
플라스마
spray.
스프레이의 약자가 티타늄 플라스마 스프레이.
On implant
임플란트
surface,
표면에 티타늄
plasma coating was
플라스마를
added.
이제 이렇게 코팅을 하는 거죠. 그런 효과를 이제
This
가져왔는데
is no longer
사실은 지금
used.
이미 사장이 된 그런 표면이겠고요.
And there's SLA, which stands for sandblasted with large grip and acid etch. In other words, in order to make the surface rough, physically sandblasting is done and strong acid is applied to enable chemical corrosion or etching. So, sandblasting, which physically roughens the surface, and acid etching, which is chemical process, is combined. This is SLA. RBM stands for resorbable blasting media. In order to make implant surface rough, blasting process is done. The substance is resorbed on the implant. That's why it's referred to as resorbable blasting media. Many companies, along with Ostem, produce a lot of implants with SLA surface. And third generation surface is where chemical properties are added. Through various research, surface treatments are done in Ostem. There are products that underwent surface treatment. HA, which stands for hydroxyapatite, is component of bone. Plasma spray coating can be done, and nano HA coating is also an option here. Nano calcium phosphate coating can be done. Others include implants with improved blood wettability by switching from a hydroxyphobic surface to hydrophilic surface. When we place implants, in order to promote osseointegration, there needs to be more blood. Therefore, surface has been changed to hydrophilic surface. With this, wettability is improved. Such surface treatments are continuing to be developed. Hydroxyapatite coating. On implant titanium screw surface, we add HA, which have the same constituents as our bone. It is artificially synthesized and it is coated on the surface. If there's HA coating on implant surface which has the same properties, then it'll be more favorable for osseointegration. If you look at other options, they have similar function. This is Ostem's calcium CA. It refers to calcium SA, and BA surface, which refers to BioHA. Ultimately, these options have slight differences, but basically it makes the implant surface more rough and it promotes osseointegration by inducing biological or chemical reaction. The goal is to gain osseointegration quickly and to provide prosthesis within shorter time period. In the future, if such biologic properties can be reinforced, we would be able to get better results.
보강을 해가지고 제품들이 나올 것으로 그렇게 우리가 기대를 해보고 있습니다.
This is the end of my online lecture, which addresses a part of the offline lecture. If you're interested in specifics, please come to my offline master course lecture.